Sorry, just as you were getting
That's okay. I think we'll make a start because we do have people who are watching us online tonight. When we run our seminars now, we do actually run them as live webinars at the same time. So please don't be concerned about these lights or there's no camera shots of anyone who's here in the room tonight. But we do have a significant number of people who've joined us on our webinar cast tonight. I know we've got someone, Alex in Sydney, and quite a few others who I've spoken to throughout the week who are joining us. So welcome to everyone who is actually watching us and joining us online tonight. There's a chat feature, so please ask your questions as we go. And the same to all of you here tonight. This is a really great opportunity. You, a small group, ask as many questions as you like. That's what we're here for. I'd firstly like to introduce myself. I'm Felicity. If you're recording, it will actually be on. You can access the webinar afterwards as well. So there's a registration link. If you want to review anything online, it will all be recorded. So I probably you're not recording it on your phone, are you?
No.
Oh no, that's okay. Okay, perfect. No problem at all. But if you can actually access a recording and watch this again if you forget anything at all as well. So first of all, my name's Felicity, and welcome to all of you here tonight. And thank you so much for coming along. Warren, you're just right in front of the camera. Yeah, so that's the webcam. That was a great introduction to the back of the head of our psychologist, who will actually come and chat to you shortly.
I'll show you
You're
his
not a
face.
dentist, Warren. You're allowed to show your face.
Cameras everywhere these days.
I'd first of all just like to tell you a little bit about Weight Loss Solutions Australia. This is a business that's been functioning here on the Gold Coast now for about 14 years. And I've been involved with this business right from the outset and had the opportunity of growing with this industry, and the changes that I've seen take place through advancement in technology are fairly significant in that space of time. So originally, you're probably all aware of the gastric band. And when we first started this business, that was actually, there was a one-size-fits-all. That's all we had to offer patients, the gastric banding procedure. And it is a fantastic device, and it suits a lot of people, but it's not for everybody. And we're at a stage now where 14 years later, there's so much more that we're fortunate enough to be able to offer to patients. And so the kinds of procedures that you'll hear us talk about tonight are firstly the Orbera intragastric balloon, which is a temporary device and aimed for patients who need to work on a lifestyle modification program and looking to achieve a weight loss of generally between 10 to 15 kilos. And then the gastric band is a procedure that I'm assuming you've probably all heard of, am I right? Anyone here specifically interested in the gastric band tonight? Hands? No? The sleeve gastrectomy, which I think probably is becoming a far more popular option for patients seeking out a solution that will give them a permanent solution to weight loss. And of course it is permanent. We're going to hear all about how the procedures work and the technical aspects of them shortly. And then there's also bypass, mini bypass, you've probably also heard of. So there's a whole host of procedures, and in the scheme of things it's really important that we assess each individual patient based on your own personal circumstances, health circumstances, lifestyle circumstances, and so many different factors that are that we kind of help us to make sure that we're informing you of how to choose the best procedure for each individual. So tonight we want to walk you through the process, and we'd like to give you the opportunity to ask us absolutely anything you'd like to know. And we hope that by the end of this evening that you'll leave here as well informed as you possibly can be. So that's the whole intention of tonight. And congratulations to all of you for taking that significant step in choosing to come here tonight. I know it's a really difficult thing to actually choose to come along to a seminar of this nature. And it's quite a life-defining moment for many people. This is actually where you make that decision that you need to actually address for your own health purposes or for whatever reason, whatever that light bulb moment has been for you that's drawn you to come along tonight. So congratulations to all of you and welcome. Thank you for joining us here tonight. I'd just like to start by introducing you to all of our team members who are going to present to you tonight. We will hear shortly from Carol, who's going to talk all about the surgical procedures and how they work. Carol is a registered nurse with many years of experience and has worked alongside me in this business for almost as long as I've been here as well. Melanie is our Patient Relationship Officer, standing just up over there chatting away. Many of you may have already come in contact with Melanie, booking your place to come along tonight. And she's not just here tonight as the Patient Relationship Officer, but she'll also tell you a little bit about the experience of having had bariatric surgery. Dietitian, so she's going to actually tell you all about how food relates to each of the procedures and her role within the team and that team approach. He's our psychologist. Don't be scared of him. Please ask him questions. We love it when people ask the psychologist questions. All about his role as the psychologist member and what that means to you as a patient and how each of these people contributes a significant role in assisting you to gain maximum benefit from whatever procedure you choose. And if there's one thing I can share with you now is that this team of people are incredibly passionate and dedicated about what they do, and what they share with you and work with you for the long term throughout the whole process of assessing and dealing with you as a bariatric patient. You need to enlist their support whenever you need it. It's available to you, and it's a really important part of achieving great outcomes for you. I think I might just leave it there for now and let Carol come along and tell you all about the procedures, and I'll be back to chat with you shortly.
Thanks, Felicity, and again, welcome everyone. The procedures that I'll go through tonight will just be all of the procedures that Felicity spoke about briefly. We will give you the opportunity at any time to ask any questions, so remember this is an overview of what all the procedures are about, and if you do have any questions, please feel free to ask them, and we'll be available afterwards as well if you feel like your question's a little bit more personal or you just want to have that one-on-one chat. So to start off with, we'll go through the least invasive of all the procedures, which is the Orbera intragastric balloon. And they've tricked me, it's on this side tonight. Basically, the balloon is a procedure that is a temporary procedure, so that this balloon sits inside your stomach for 6 months. And it gives you a chance to be able to change habits, to work with your diet, to maybe start an exercise program, to do all of those sort of things, so that then once it's removed and we follow you up for the next 6 months, it's about consolidating all of that weight loss that you've had already. Averagely, if that is such a word, on the average, we expect people will lose about 10 to 15 kilos. Lose nearly 30 kilos with it. Now that is more the exception than the rule, I'll let you know now, but most people would lose somewhere between that 10 to 15 kilos, give or take a little bit more, or maybe even a fraction less. It's a pretty simple procedure, so it's a day procedure only. This is it deflated. So you can see that it would pretty easily just, when you're asleep, go down into your stomach and then get inflated. The balloon's actually filled with some saline that's coloured blue, so that if anything was to happen to this balloon, then you would start to pass urine that's very fluorescent green, and that would alert you straight away that something needs to be done about it. I'll pass them around just so that you can have a little look. It's a great procedure. It's great for people who have, for example, needing knee surgery or something like that. They just can't get that extra weight off before their surgery, yet they're informed they've got to lose weight before they have their surgery on 22. They can't exercise and they just need that bit of assistance. But it's also great for people whose body mass index is somewhere between about 27 and 35, and who just want that bit of a kickstart, who want a boost to be able to just know that they can change their patterns and change their habits, before things get a little bit more severe. So the balloon is also taken out exactly the same way. It's put in just by gastroscopy and under a light sedation, but you aren't aware of it. even
So
though
they
it's
take the
not.
saline out first?
Yes, absolutely, yes. They sort of grasp the balloon and suction all the fluid
That's a
out.
stupid question, now I'm visualising.
Yeah, no, it's not a stupid question at all. No question is ever stupid, so please don't feel embarrassed if you've got to ask a question that, you know, other people might find that they know straight away. But, you know, every question is important because it's important to you. So, yeah, that's basically the balloon. It's a pretty simple, self-explanatory procedure, but it works well. Okay. The second procedure that we offer is the gastric band. Now, I noticed that people didn't put up their hand that they weren't interested, but please just let me go through just a little bit about the band, because the gastric band has been around for many, many years now. And it was the only procedure that we had to offer, you know, those 13 or 14 years ago that Felicity and I first started working in this area. It's still a minimally invasive procedure, which means that it's done by keyhole surgery. It is totally reversible, and it's a great way of being able to lose weight and keep it off. Even though it's a reversible procedure, it's not put in with the intention of removing that gastric band. It's put in with the intention of leaving it there, so it is a permanent procedure. How the band works, or what it looks like, is this. So when doctor puts the incisions into your abdomen and then wraps this around the top part of your stomach, so essentially your stomach then looks a bit like an hourglass, so that the food that goes in sits in the top part of the hourglass and then slowly digests into the bottom part. The difference with the band is that it has this port that's attached to the tubing that sits in usually the upper part of the abdomen, not protruding, but if you were to lay on the doctor's tables, they would be able to press into your abdomen and actually feel this port. Now that allows for this band to be adjusted. So when you have maybe your weight is starting to plateau a little bit, maybe you find that you're eating a little bit too much, we want to keep you in what's called the green zone, which Tara and our dietitian will go through with you tonight. But it can be adjusted, so a little bit of saline is put into here and it adjusts in this little part of like a little bit of a balloon on the inside of the band, and that in turn tightens around your stomach again, and it makes the aperture inside a little bit smaller, which means you're reduced and you're fuller quicker, and the amount that you need is not so much, and then it just slowly digests again into the bottom part of the stomach. So again, it's a pretty basic sort of procedure when you think about it. Oh, okay, I see how that works. I'll pass that around for you. But it's a very, very effective procedure. And we still have patients that we're seeing that have had surgery 10, 12, 13 years ago when we first did this surgery, and they still come back and have a little adjustment every now and again. That's the main thing with the band, is that you are a little bit more in control. So you can adjust a little bit tighter, and similarly it can be adjusted a little bit looser as well. You do have to be prepared to be committed, as with any procedure, and watch what you put in your mouth, because that control comes from you. But we can educate you, we can guide you through those things. Some of those things some things you might not be able to eat with the band. Primarily those things might be white doughy bread or red meat, or things that are a little bit harder to digest. But basically it will help teach you how to eat slowly, how to eat smaller portions, and it gives you a little bit more control again. Okay. Hospital stay with the band is usually one night. So with the balloon it's only a day procedure, with the band it's one night. And return to work is probably somewhere between a week to 2 weeks, depending on the type of work that you do. Complications are quite simply the same as any other medical or surgical procedure. Infection is one of the main, any wound infections. And as a long term, the complications that can happen with the band is either band slippage, so it just slips, or band erosion, which means that it goes through. Both of those things are not easily, but they do require another surgical procedure to have fixed. Okay? And the risk or the complication rate is probably as low as 2%. So it's pretty low in the full scheme of things. Okay, is everybody okay with that so far? Okay, so then let's move on to the sleeve. So the sleeve is becoming more and more popular with people. It doesn't require as much follow-up as far as adjustments and those sort of things go, but it's a very, very good procedure also. It's a permanent procedure and it's not reversible. So the sleeve is performed where by keyhole surgery again, so it's still classed as minimally invasive, but it's where they cut away about 2/3 of your stomach. So when the 2/3 of your stomach is cut away, it can't be put back again. It's beautifully sealed by these amazing equipment that they have now that cut and staple and glue and all of that sort of thing all at the same time. So it reduces the risk of leakage or bleeding much, much more. And once that stomach is taken away, it's sent off to pathology just to be checked, to be on the safe side. So you're left with a small or a narrow cylinder type stomach, which is a bit like a sleeve, and that's where it gets its name from. As I said, it's a great procedure. It would find a quicker weight loss. You know, if you're comparing the band and the sleeve, you'll probably find that if you had the sleeve, your weight loss would be quicker. But in the long run, when you're looking at things long term, you'll find that the band catches up and the weight loss is still the same. So it evens out in the long run. So it basically comes down to what's the best procedure for me? And that's where our team come in, that you can talk to the dietitian, the psychologist and the doctor. And we've got our other registered nurse who's here 3 days a week, and she's our main person who does band adjustments for the gastric band, but she's also here to do wound checks and those sort of things as well. So we're here as a team to be able to try and help you choose the right procedure for you. Okay, and that can be different from the person sitting next to you. You know, whatever is right for you might not be right for somebody else. Hospital stay with a sleeve is 2 nights, and back to work probably a week to 2 weeks again, although probably a little bit more like the 2 weeks. And that's mainly also not only about the healing inside, but it's also about the type of diet that you need to be on afterwards, so that you're not, you know, working and finding it difficult to just be on fluids only and that sort of thing. Basically, that's it with the sleeve and with all of the procedures that we offer. Does anybody have any questions at the moment about the types of procedure or anything that they've thought about they'd like to ask?
With the sleeve, is there any possibility of it leaking or opening?
Yes. In the first, probably what we call the acute phase, so maybe the first 24 to 48 hours, there is, doctor quotes a percentage of 1% risk of leaking or 1% risk of bleeding. So after surgery, the following day after surgery, he'll get you to have an x-ray where you swallow this not too pleasant sort of fluid, and it just makes sure that that seal is good. Okay, and that's why they use the equipment that they use to be able to make sure that it's when it's sealed and it's cut at the same time. I don't know if any of you ladies are sewers, but it's a bit, I think, a bit like an overlocking machine. You know how an overlocker can sort of overlock, I suppose, and cut at the same time, is that right? Yeah, so it's the same sort of thing, except obviously in a much more technical and secure way.
Have there been any cases where it's broken or?
Not in the long term, it's been more in the acute phase. That yes, there are, that's where the 1% would come, that's the risk of that. And when you look at the amount of procedures that are done, that's a very, very low risk. Yeah, but it's something that doctor will talk to you about at your consultation. He will make sure that you are very aware that there is, you know, there are risks. It's the same with any type of surgery, but you need to be aware that that can happen. Yes.
Does the stomach grow over the staples in time?
It's a good question.
Is
I
it
don't know
like
whether
it's
it's actually growing over, but they certainly seal.
Yeah.
The cells do grow with the stomach, and it does seal.
Because I had a lap band, I've just had it taken out,
Uh-huh.
and it showed that scar tissue had grown like over the tubing, and
Yes.
the lap band had twisted.
Mhm.
So that's why I'm asking that question, because of the scar tissue. Maybe the scar tissue may grow over
Yes.
the staple.
Yeah.
I just,
Whenever you have any sort of surgical procedure inside your abdomen, scar tissue forms. It's a little bit like if you were, a young child riding their bike and they fall over and graze their knee. To a degree, there's that scar tissue that has to form
that
because
might
it's new
seal it
cells.
a bit more, maybe.
It might, sorry?
It might seal it a bit more.
Yeah,
maybe.
absolutely. Yeah. But to start off with, they have to have a really good way of making sure that stomach's going to be secure before, otherwise if they only did it higgledy-piggledy, you'd certainly be leaking, wouldn't you? And we certainly don't want that to happen. So, there's about 3 layers, a bit like bricks, of staples on both sides.
Yeah.
So even the piece of stomach that is taken also sealed. Contents or anything that go into the abdomen.
And they're plasticky or
No, they're titanium, they're called.
So they're
So
not
that-
going to go off when you go through the airport.
No, they're not. No, they're not. And they're not going to rust either. So that's one of the main
Just don't want
things.
to be pulled aside.
It'd be a bit hard to take those off,
Yeah.
wouldn't it? No problem with going through the airport or anything like that. No. Any other questions?
Are
Yes.
there any restrictions with the sleeve, sort of after 2 weeks, to do with lifting or that sort of thing, like?
Okay.
Like
That's
major
another good
surgery?
question. Yep. It is still inside. It's still quite substantial surgery. So even though outside you've got keyhole, inside there's certainly your muscles have still been gone through, and there's still a fair bit of work done on your stomach. So we suggest that you don't lift anything heavy for no lifting at all for 2 weeks, and then possibly just minimal lifting for the next 2 to 4 weeks after surgery. So if you've got a very manual job where you've got to lift a lot of heavy things, you might like to consider extending the time off work or seeing whether or not you could go into light duties for 4 weeks when you do go back to work. And we can supply a medical certificate to state that. Yes.
Many people report ongoing nausea or vomiting in the early stages. Bit of research that I've done, like you said, everybody's got a different story. And actually, for the group, I've been Googling horror stories, and I've found very few. And the horror stories are only things that say, they'll report the negatives, but every single one of those people have said, but I'd do it again.
Oh,
So
interesting.
just so you know, I've been avid Googler for weeks at this. So,
Good on you,
but
I like that.
I just wonder if, that's probably the thing I fear the most, is all the stuff about how much food you can eat and what you can eat. To me, that's not my issue. It's, am I going to feel sick for a good while? And I don't know about anyone else, but that's just, I struggle with that. Done enough babies and gone through that. So, nausea, vomiting, is there a lot of that?
I haven't had it, so I can't speak personally, but from the amount of patients that I've seen, I would say that the main answer to that is no. There is going to be some reflux afterwards that we put you on a medication for at least 1 month after surgery. And sometimes just in that first week after surgery, people find that they do feel a little bit nauseated because they've got to get a certain amount of fluid in as well. So it's a little bit of balancing. That again can be controlled with the medication. Tonight the advantage is that we've got a couple of beautiful people here that are going to be able to share their story and will actually tell you how they felt personally. And I think you can't beat that. Is to actually hear how somebody else has felt because they're both very different in any case. But yeah, they'll be able to at least tell you whether or not they felt anything like that.
Thanks.
Yeah, no problem. Okay. Well, I might hand back over to Felicity, and we'll all be available later on to answer any questions if you've got any more. Thank you.
Firstly, I apologise to everyone in the room who missed the very beginning of the presentation tonight. You haven't really missed anything. I might have jumped the gun and started a bit early, so I do apologise. That was really for the benefit of those who are logged on for watching our webinar. Anything that you haven't heard from the beginning of Carol's presentation, you're more than welcome to discuss with her at the end of tonight's presentations. Probably one of the things I would say about risk, what are the risks of being overweight, or being a morbidly obese person, and what are the risks for you for your health and your future. That will be something that I would actually be seriously thinking about. And one of the reasons that we, or the most significant reason that we actually offer bariatric surgery, is to address the medical and health related issues. That's the predominant reason. That's the first and foremost, most significant area that we need to consider in a patient's medical profile. And in fact, tonight I was actually just rushing from doing an interview with a beautiful patient, a lovely lady who had a gastric band, and we were talking about all of the things that she'd experienced before making that decision to have her surgery quite a few years ago. But she had very severe obstructive sleep apnea, and she actually found out that she was actually, I think it was 80 times a night that she was actually ceasing to breathe efficiently. And that was probably the main thing that drove her to say, well, actually, I need to do something about my weight. She had family history of diabetes, of hypertension, and other medical related problems. And so what we see with our patient population that is unfortunately increasingly getting heavier and heavier, and the need to treat more and more patients is has never been more significant from our point of view. Type 2 diabetes, we know, is such a significant and dominant health condition in our population, and it seems to be getting more and more severe. So these are the kinds of things that we need to think about, and you'll actually hear from one of our patients tonight some of the medical conditions that she was actually experiencing and how quickly they resolve post-surgery. So think about what are the risks to you if you don't actually consider making a significant effort to put yourself into a healthy weight range. And for pretty much for most people, addressing this with a bariatric intervention is your only chance of actually achieving a significant amount of weight loss, but a sustainable amount of weight loss for the long term. And that's what we're looking for, that this has got to be about safety, efficacy, and long-term sustainable results. And that's what we're looking at, and it totally transforms lives. And talking to this lovely lady, Juanita, in this interview tonight, I can tell you that the way she's transformed her life has been not just about weight loss, but engaging in a very physically active lifestyle. She's actually she's chosen in the next 12 months to do a bikini modelling competition, bodybuilding type competition. She would never have even dreamt of doing anything like that prior to surgery. And just one thing I'd like to share with you is that, you know, for each and every one of us, the statistics show that 1 in 4 Australians is suffering from morbid obesity. That's just not actually being overweight. That's our statistics related to morbid obesity. So for all of us in this room, we're all touched by knowing someone, whether it's a family member, a friend, a relative. We all have probably had some contact that makes us aware of the issues related to morbid obesity. For me personally, it was growing up with my mum, who was significantly, I guess, impaired by being so overweight. She'd been a very active lady in her youth and was an equestrian rider, and you know, but I didn't know her then. Unfortunately, as a girl growing up, I saw my mum as a significantly overweight woman, and it had a huge impact on my life. And you know, for us here, this is our passion. This is what we do every day, and you know, transforming lives to become healthier, happier, and hopefully keeping you out of nursing homes in the future. All of those things are what we think about and what we believe is so important to address for each and every one of you looking to achieve a significant weight loss outcome. All right, I'd like to now pass on to Taryn, I think. Are you next, or is Warren next? I've forgotten the order. It must be a while since we've had a seminar. It must be more than a month. I think we'll go with Warren then. Let's not argue. Okay, Warren, would you like to come on up? I'll hand over to you.
Thank you. Well, thanks for everybody for coming in. Obviously, I'm a psychologist, and everybody who comes to our clinic comes and spends a little bit of time with me. And contrary to most beliefs, it's a pretty informal process, and nothing for you to be too worried about or too concerned about in terms of you know, what you're trying to achieve. We're all here to help you, and I'm one of those people who becomes part of your clinical support network. So to give you a quick idea of what happens is you come and spend roughly between 50 minutes and an hour with me. So and we talk about you, your background, family dynamics, weight loss history, current work-life situation, work-life balance, attitudes towards certain foods, eating habits, anything that is relevant that I feel I need to sort of capture as part of the information that I feel is necessary to support you through this process of weight loss surgery. So the more I know about you, and the more I know about your background and what you're trying to achieve and what your goals are, and what this really means to you, then the better equipped I am to help you as part of your support network. So most people who get to this stage will have a degree of support in the home environment, but sometimes that support, even though it's offered to you and you've got family there to support you through the process and they're very encouraging of you making these decisions, it's important to also have clinical support where you can step aside from those opinions and views of people around you who often, despite good intentions, may not get their views across the best possible way. So sometimes it's really important to have that clinical support here that's away from the home network and family and potential views and opinions that might unsettle you. So you can come here and you can talk to people who've got experience in this industry to help you along. So the way I like you to look at this whole process when you come and see me is come with everything, all your baggage, and bring it all to me, and let's talk a little bit about what you want to achieve, and then we can strategize about how we're going to get there. Because if you think about a weight loss journey can be anywhere from 9 months for some people, excuse me, to 2 years and even up to 3 years. So if you think about even 12 months is a long time in somebody's life, and a lot can happen in that time. And what we want to do is we want to put ourselves in a situation where you are having a fair degree of success, for example, from your procedure, because most of these procedures are actually quite successful. So if you compare them to, say, conventional diet and exercise methods, for example, there's a very high success rate. So we know that you're going to have a degree of success, but what we want to do is we want to be able to make the most of the opportunity you've got to lose the weight that you want to lose. So in that process of 12, 24, 36 months, a lot can happen. And so we want to give you an opportunity to be able to come in and address those situations, even if they're not related to your weight loss journey. They may be affecting your weight loss journey because perhaps you don't have the right support at home, or perhaps things have changed at home. Perhaps the family dynamics are under a little bit of pressure. Perhaps your work-life balance has changed. So we want to give you that opportunity to come and address your issues and then get you back onto that sort of level playing field where you can actually keep doing what you're doing, keep striving for your goals. So that's really what it's about. So for that reason, we schedule 5 consultations for you after surgery in the first 12 months. And so basically, to give you an idea, we see you at 6 weeks, we see you at 3 months, we see you at 6 months, 9 months, and 12 months. And the first session at 6 weeks is actually a group session. So it's the only group session that we run at the moment. And things are certainly subject to change as we move forward because we're always trying to look at better ways to support patients. But in the first 6-week group seminar, you'll see Taryn and myself. And basically what that is it's an opportunity for you to meet like-minded patients who've all had a similar procedure to you around the same time as you, going through the same challenges, probably in most cases having the same benefits around the same time as well. So even at 6 weeks, we see patients who have made quite a few strides as far as their weight loss journey goes. So it's a very encouraging time for us to catch up with you. And it's also sort of coincides with you having gone through the most challenging stage of your weight loss journey, those first 6 weeks, because you're on limited, a very restricted diet of fluid replacements and puree, etc. So we really want you to have the opportunity to get through those first 6 weeks before we give you any other information that we want you to follow through with. But that 6 weeks seminar also sort of coincides with you making your transition to solid food, and Taryn will have a lot of information to give you regarding your diet, and I've got information to give you regarding how you can start getting motivation to be more active. Okay, so that's that's also, again, in a room with people who are like-minded, unbiased, and pretty much have a lot of empathy, and they understand what you're going through because they're probably going through the same thing. Okay. Then you'll see Taryn at 3 months, and you'll see me at 6 months, Taryn at 9 months, and me again at 12 months. The one thing that we do offer in this clinic, which is rather unique, as far as I know across Australia, is that we give you unlimited access to our support in those first 12 months. So if you feel like those 5 sessions that are booked for you are not enough, and perhaps something's happened in between your visits with us, you have every opportunity to come back and talk to either myself or Taryn or both of us, so we can help you. So really what we want more than anything else is we want to be a part of your journey. We want to be a part of your success, and we want to help you every step of the way because we know how challenging it is and we know what's taken to get you to this point. So years and years of exposure to failure with conventional methods. Teachers doesn't really teach you much about what needs to change in terms of your behavior. So your opportunity to come talk with me is about addressing those issues. And I always encourage patients to look at surgery rather than looking at weight loss surgery as a method for weight loss. Look at it as a method for behavioral change. Because that's what keeps you focused on the process of what you're trying to do rather than the end result. Because often when you're too focused on the end result, we don't learn anything along the way. So we don't really learn anything about the behaviors that need to change. So that's what we talk about. I think that pretty much covers it. So, does anybody have any questions for me? Yes?
I've read about, things like you get on the ghrelin hormones.
Yeah, ghrelin, yeah.
How does that affect, like, they cut that off and it's supposed to do something in the brain?
Yeah, they don't cut ghrelin away, but ghrelin's produced in this part of the stomach. It is actually removed. So the 80% of your stomach, for example, in sleeve gastrectomy, that's removed. It's where the hormone ghrelin is produced. So ghrelin is a hormone that is, from what they believe, is typically responsible for sending those signals through the hypothalamus and onto the brain regarding your appetite, and your cravings, and most things around food. Okay, so it is something. Ghrelin is something that does actually reproduce. So it does come back 12 to 14 months later. In obviously the smaller part of the stomach. So it comes back in minimal amounts, of course.
But hopefully you re-educate
Yeah,
your mind.
not so much. Look, you don't lose everything with regard to your food. It's certainly worthwhile noting that in the early stages, when it is removed, that you will probably in some cases have to remind yourself to eat. And particularly since one of the important things is maintaining your metabolism and maintaining your daily nutritional needs, and that becomes very difficult if you're starting to skip meals. So to maintain all of that, it's important that you eat regularly and you have good nutritional value. So there are going to be times, yes, where you probably feel like you could, when you come to mealtime, you could take a relief, but it's really important to maintain and take your meals where you can. So even if they're small, it's very, very important. So ghrelin, yes, they believe it is responsible for that. But you don't lose your complete association with food and your love for food, but you certainly might find that your taste for certain foods have changed. So for example, sweet foods may appear to be overly sweet, too sweet. So if you're somebody who had 2 teaspoons of sugar in your tea, you might find that half a teaspoon is enough. You might find also, for example, that oily foods don't settle really well either. So it's not the same for everybody. There are some generic things that we can certainly go over with you that you can expect will happen. But yeah, it's something that does reproduce back in the stomach.
Okay, thank you.
What happens when you get down to the weight you want to be? Like, what stops
way I look at gastric sleeve surgery, and all is it's giving you part of your life back. It's saying to you, look, whatever you've done over the last 20 years, 10 years, however long it's taken you to gain that weight, it's saying you can have those 10 years back again. It'll take you about a year to 18 months to get to that situation, and then you start again. It's saying that you can start this whole process again. And if you're given that opportunity, how would you do it differently? Well, if you don't talk to somebody about the behavioural things that you want to do differently, you're going to make the same mistakes, aren't you? Exactly right. So, in 10 years from now, 11 years from now, if you've gained weight over the last 10 years, there's nothing stopping you from making those same mistakes in the next 10 years. So the way to look at surgeries is not a foolproof exercise. It's an opportunity to start this process again. No other questions? Yes?
Sure. With people that have depression on a very high dose of medication, because I've read too that people that are suffering depression, they have this operation, they lose all their weight, their depression or the need for the medication ceases, but how would you know when to cease the medication? I know you confer with your doctors all the time, but
yeah.
How would you know the difference of feeling happy because you've lost weight or you're happy because you no longer need the antidepressants?
Okay, the first thing I'm going to tell you is weight loss does not equal happiness. Okay, that's a very common mistake that people make. So what weight loss does is it improves your self-efficacy. Now, self-efficacy or low self-efficacy is the root of depression. Okay, so that we do know. So what we have to do is, it's a bit like, if you wanted to lose 25 kilos, well, we can do that two ways. We can do it the right way, and we can do it the wrong way. We can put you in a cage for 12 months and feed you bread and water, and you're going to lose 25 kilos. It's not going to teach you anything about what you need to do in the process, nor is it going to give you the opportunity to go and do the things that you perhaps stopped doing as a result of the weight gain. And nor is it going to encourage you to not isolate yourself as much as you've done since you've gained the weight, etc. So you have to be given those opportunities to, reintegrate yourself a little bit more into social means and social gatherings, and you have to give yourself the opportunity to also perhaps start doing the things that you haven't done for a long time. So this is about rebuilding your self-efficacy. It's not about making you happy. Yeah. So rebuilding your self-efficacy is basically getting you to come in and talk to, for example, myself, and find out what it is that's actually missing in your life. Because what's missing in your life is what's making you unhappy. Okay? And what you're not able to do, for example, as a result of your weight, particularly if they're things that were very meaningful to you growing up, or meaningful to you as an adult, for example. We need to bring those things back. We need to find those opportunities. So not often, but sometimes what people do is they'll lose their weight, and they'll give me a whole bunch of reasons that they want to lose their weight, both health-related, physical-related, mentally-related. And they'll get to give you an example. Somebody comes in and says, the catalyst for them coming in to make this decision was they went to Movie World with their daughter or their son, couldn't go on the ride, and found it quite embarrassing and distressing, and came in and said, I've got to have this surgery, I've got to lose this weight because I'm missing out on these opportunities. And they go and they have the surgery, and they lose all the weight that will allow them to go on the ride. And this takes them 9 to 12 months. And then I see them at 12 months. Do you think they've gone on the ride? No. It answers your question. Okay. So unless you get on the ride, you're never going to really know what you've achieved, have you? Okay. So you're still going to be the same person. And it's often spoken of in these terms, and they use the word fat in this situation. But a lot of times what people don't realize is that, if you don't make these changes, you're still a fat person in a thin body, just 12 months later. Okay. Right. Thank you.
Thank you very much, Warren, and thank you all for asking questions tonight. It's fantastic to see you asking those questions and for Warren to have the opportunity to engage with you like that. It's rare that we have questions for the psychologist, so I appreciate your questions. If I can just ask everyone online now to just actually indicate whether the audio is working well enough for you now. Just send us a little yes or no if you've got an audio issue, and Melanie will address it for us. Thank you.
I'll acknowledge you, but I certainly won't fix it.
Okay. All right. I'd now like to call upon Taryn to address all of the dietary implications for all of the surgical interventions. And once again, please ask your questions now. It's a perfect opportunity. Please make Taryn welcome. Thank you.
Okay, so yeah, thanks for coming along tonight, everybody. I just want to spend a little bit of time running through just a bit of information about what my role is here and just what you can expect going through the process. And yeah, feel free to ask any questions as we go along. So basically, I will see everybody before you have whichever procedure it is. So whether it's the Orbura balloon or the band or the sleeve, we also do see people here non-surgically. You know, maybe in a situation where someone is waiting for their health insurance to kick over. You know, we've had people that have been coming for 12 months before they actually have their surgery, sort of starting to look at implementing some changes and that sort of thing. So yeah, we just like to sort of sit down and get to know a bit about your background, so your sort of medical background, your you know, what sort of diets and methods and things that you've tried before, and what your lifestyle's like. So just having a bit of a look at your normal eating patterns, and that's just to really help try and prepare you for what it's going to be afterwards. So it's a fairly, it's a fairly big change. There's a big learning curve to go through, especially in that first couple of months. So a little bit different for both of the procedures, and I'll sort of touch on the difference between them. But there's really, it's sort of like there's two distinct parts to this. You've got your early phase, which involves a pre-surgery diet, and then there's sort of like a transition from liquids to purees, and then gradually getting back to solid foods as the stomach heals. So that takes about 6 weeks, well, yeah, about 5 or 6 weeks post-surgery. And then you've got the long-term management, and that's something that doesn't really stop, you know. So we sort of, you know, we have this 12-month package where we actually see you, you know, as much as you need really for, you know, it can be anywhere from 5 visits to monthly visits. You can come back as much as you need, but it's really something that does require ongoing input for the rest of your life, really. So just to sort of touch on a little bit that the pre-surgery diet that we get you to do for a couple of weeks before, that's something that the surgeons require because it's actually about getting your body fit for surgery, really, and it reduces down the size of your liver, and they need to sort of get in and move that over so they can get to the stomach. So we sort of go through the guidelines of that. It's basically like a very low calorie diet, which, yeah, can be a bit challenging for some people. For others, sort of just get in there and get it done. And so it's quite structured for your first couple of weeks before, and then the first 2 weeks after we give you pretty specific guidelines about meeting fluid targets and, you know, trying to get enough protein and getting enough energy in there so that you can actually recover as best as possible and feel well. So once you have got back to normal foods, we really like to work with you to, you know, make sure that you're getting what you need nutritionally. So suddenly you've got a much smaller capacity to eat, so all of your meals will be much smaller. We sort of use a bit of a ballpark amount of about 1 cup per meal, so you know, it'll start at less than that when you first start back on puree. Say with the sleeve, for example, we're talking, you know, about 1/4 cup each meal to start with, and then it sort of goes up to 1/2 cup, and you know, a couple of months down the track you'll be eating around about 1 cup per meal. So, you know, there's a lot that we need to get into that small amount. So, you know, it is really important that you eat regular meals. So for people that have a pattern where they may skip breakfast and get busy during the day and not eat all day, big meal at night time and snacking at night, can't really get away with that after you've had the surgery. You're just not going to be able to get everything that you need. So we need to sort of really work on getting some nice regular eating patterns up and running. I might just touch a little bit on the band and the sleeve and just how they differ. So with the band, you've got the band that goes around the top part of the stomach, so it's sort of creating this narrowing that the food needs to actually pass through. So one of the really important things with a band is that you actually eat slower than normal. So that can take a bit of retraining. You need to really sort of chew every mouthful well and make sure you eat nice and slowly so it's not getting sort of stuck in there. I think Carol sort of mentioned before that the band's adjustable, so you actually come back into the clinic, and it's just a really simple procedure that the nurse does here in the practice. It just takes a couple of minutes, and it involves sort of putting a bit of saline into the band, which can make it tighter or looser. So, and that's a really important feature of the band, and it's really really important to try and work with that and get it right. So, a band that's too tight can cause all sorts of problems. You can have a lot of difficulty eating textured foods. So, that's where you sort of see people might find it, sit down to eat a normal meal, some meat and vegetables, and can't eat it, regurgitating, coming back up. So that's often an indication that there's a little bit too much fluid in the band. And the other extreme, if there's no fluid in there, you'll usually be able to eat pretty much unrestricted as though you don't have a band, and that's not ideal as well. So we need to just sort of work with you to get it to the right spot, and that can take several adjustments. So, and that sort of involves just sitting down and talking about where you're at with it. But when you get your band to that right spot, you should be able to eat a pretty good variety of foods, providing you're chewing well and eating slowly. So yeah, it is a process to go through to get you to the point where you can actually eat a well-balanced diet, but it's certainly, we do have a lot of people that do really well and are able to eat, well-balanced diet and keep themselves well-nourished. Now, the sleeve is a little bit different in that it doesn't have that sort of constriction that the food needs to pass through, so it just goes straight down into the stomach. But it's very restricted in the amount. So, and it's a really, really clear sort of cut-off point. So once you've had enough, or you start to get the sensation that the stomach's full, you might feel a bit of pressure in the stomach area, and you really need to stop. So there's no getting away with, there's just a few mouthfuls left, I'll just finish that. So that can be enough to really tip you over the edge and make you feel really uncomfortable. So it takes a bit of getting used to. Most people will get to the point where they say they just know when they need to stop. Might have made a mistake a few times and had a really unpleasant experience, so they sort of get the idea that that's not something that they want to be repeating. So yeah, it's sort of getting a feel for how much. And also definitely making sure you're getting that nice regular eating pattern, so small and often through the day. So it doesn't restrict you a lot in the types of food. Early on it can, so some people will find that as they're just adjusting, getting back to normal foods, there might be some things that feel more uncomfortable, so you might sort of err towards maybe some soft meat or fish as opposed to a piece of steak, 6 to 8 weeks post-surgery, because the steak might just, it's not that it gets stuck or causes pain, but it might just feel like it sits a lot heavier in the stomach than other foods. So yeah, we just need to make sure that you're still getting what you need by sort of swapping a few things around there. A really common issue for a lot of people is eating and drinking at the same time. So it's not really the room for both. So you've got to really train yourself to make sure that so that you keep hydrated, that you're getting enough fluid in between. So that can take a little bit of getting used to as well. So now we do recommend that everybody takes a multivitamin supplement after surgery. We will be monitoring your bloods as well, just to, that it may need to be modified based on your blood test results. So sometimes we might need to add something in there. If you're eating well, taking a multivitamin, then there's no, you're not necessarily going to develop a deficiency of any sort, but there certainly is the risk there that you can decline in some nutritional, iron, zinc, B12, sort of common ones that can pop up. So we do need to touch base with you, go over your diet, make sure you're getting the best quality that you can, and sort of supplementing that. And yeah, just monitoring your bloods to make sure that you're well nourished, because we don't want you just losing weight, we want you losing weight and being healthier. So that's, yeah, it is really important. So any questions so far? Yes.
On the sleeve, if you're sick because you get a bug or something and vomiting, is there any impact on that? Does that cause any more problems, any less or more than
No, I mean you really don't. You really want to be minimising vomiting in the as it's healing. So that's why we've got a really sort of pretty specific protocol to follow afterwards. But yeah, further along, once it's all healed up, there's not really much that's going to go wrong with that. With the band, if you've got a really bad vomiting bug, then we would suggest that you actually come in and have some fluid taken out. So yeah, that can, and Melanie's probably going to tell a bit of story about that as well, so she's had an experience with that. So yeah, it can, if it's a really bad, a lot of vomiting type of bug, it can cause a bit of a problem with the band. So yeah.
Is the pre-op stuff shakes and things?
Yes. Yeah, so it's a very low energy diet, and we do use like meal replacement products, something like Optifast or OptiSlim, so there's a few different products available that you can do that with. Yeah, so you can have some veggies and things in there as well. So it's
I was
not
going to
just
say,
shakes.
if you obviously talk about that privately, I guess, but if you consultation with you, if you had your own ideas about the sort of content that could be,
Yep.
you could
Yep.
talk about that. It
Yep.
doesn't have to be dictated that it may necessarily
Yeah, exactly. So
be
we
as
need,
specific.
yeah, as long as it meets that criteria from a calorie and the sort of
Yeah.
protein carbohydrate profile. So yeah, we've needed to modify that for various reasons, whether people don't tolerate or whatever reason that we can, we can sort of be flexible with that as long as it's achieving that outcome.
Yeah, sure.
Yeah, there are other ways we can do that. Yeah. Was there?
Is there any restriction with fluid intake? Because, like the amount that you can drink at a time?
Yeah, yeah.
Just as an example, I drink about 3 litres a day,
Mm-hmm,
and I'll probably drink 15 ounce, half a litre at a time.
Yeah, that'll be a struggle. Not necessarily the volume, but you're not going to be able to sort of drink half a litre straight down in one go. Are you talking about are you thinking sleeve or band or both? Or
really.
Yeah, So if you think about the sleeve, so it's the holding capacity of the stomach is reduced, but early on, like when you first get home from hospital, it can take you half an hour to an hour to make your way through 1 cup of fluid. Then as the swelling sort of starts to go down in the stomach, you could get through that volume in 10 minutes or so. And even further along down the track, the fluids, you get pretty close to being able to drink normally, but not sculling, if you know what I mean. So if you sort of pace yourself and, you can get through your fluids in a reasonable amount of time, but it's not good if you maybe haven't drunk all day and then just go to drink a whole lot in one go. That's going to be difficult. Yeah, so as long as you pace yourself with it, you will. You may find as well that as the weight comes down, your fluid requirement comes down a little bit as well. So you might not need quite the same amount that you do now as you go and moving forward. But we have people that work in conditions where they need to have very high fluid intakes, and we've been able to manage that. But it is something you do need to, in some cases, change your habits a little bit to achieve it. Yeah.
And also, what are the risks to your gallbladder with losing so much fat so quickly?
Yeah, it can be an issue. So rapid weight loss can trigger a gallbladder attack for people that are prone to it. It's not something that we see a huge amount of, but it certainly is something that does pop up. So yeah, that is.
So you would need to have an operation to take your gallbladder out?
If that's what the doctor sort of decided is the best thing for it, yeah.
It's not necessarily though that you actually do get gallstones when you have it. Sometimes a lot of people come to us have already had their gallbladder out. Yeah, so it might be something that happens.
It can happen,
It
yeah.
doesn't necessarily mean that.
Yeah, so we do see it, but it's certainly not a common thing, is
No.
it? It's not something that we see often. Yeah. Anything else? Any other questions? Okay. Well, we'll be around. All of us will be around afterwards as well if you do have more specific questions. But yeah, I'll hand back to Felicity now. Thank you.
Thank you very much, Taryn. I just also wanted to mention to all of you, you've got bags with all sorts of information to take home with you tonight, and inside you should find a copy of Slim magazine. You will find that there's quite a bit of content and stories about some of our own patients in there, so it's well worth having a look at and reading. Just one thing that I'd like to add as far as the gastric band is concerned. I think that we all know it's received a lot of bad press of late, because not everybody has lived well with the band, and I'll just explain one of the reasons why that happens. When I mean bad press, I mean the way people chat on blogs, etc. You know, the band's been around for far longer than the sleeve gastrectomy, number one. So we've got a far longer history of patients with gastric glands inserted in. The band is a great tool, and it works effectively for people who are committed to actually comply and work with a team of people and accept what needs to happen as far as having adjustments, connecting with your team, and following certain protocol. It's a brilliant procedure. We've probably treated about 5,000 patients around about since we started this clinic who have gastric bands, and most of them have actually done brilliantly. Yes, we see some convert now because they might have had their band many years ago, and for whatever reason they might be one of those few small percentage who hasn't lived well with the band for whatever reason, whether it's been a slippage or erosion or whatever. And we're fortunate now that there are other procedures that we can offer them. That's the best part, because it would be really disappointing for us to see someone who hasn't actually tolerated a certain procedure well and not be able to offer them an alternative down the track. And that's actually a really exciting phase of the evolution of being involved with a full-service bariatric clinic, is that we can offer an alternative, but also, you know, the significant feature being that we can offer best procedure for each individual patient. So don't discount it completely. It's right for some people, it's not right for everybody. All right, now we get to the exciting part. I think we've actually sped through our presentations a little bit for you tonight so that we can get to the fun part. And that is actually really for you, I think more importantly from hearing from any of the professionals talk about their roles here, which is obviously really important, but you like to hear from a patient's point of view what they've experienced, and please ask them questions as they go. So we've actually got 3 presentations for you tonight, which is exciting, and I have to say we're incredibly fortunate to have such generous people come along and share their own personal experiences. Some of them we ask to come back every now and again, so we really appreciate their time. Tonight, firstly, I'd like to introduce you to Janine, who is about 5 months post-surgery now. And Janine, actually, this is the second time she's presented at an information night, and she actually came and said to me, it was probably only about 6 weeks after she'd had her surgery, that there were things that she felt we could have shared better with people like you in the room tonight, which is fantastic, because I think it gives you an insight post-surgery, and also for someone who's at this still early phase of where they're heading. Great opportunity to hear from Janine and to hear.
Hi, well, I was sitting where you guys were sitting about 5 months ago. Came and had a listen to, and after I heard it, I'd made up my mind that I wanted to get it done. I'm a twin, and I've always been the bigger twin. She's quite skinny, and I was always the big fat one. So what made me make up my mind was I had gone to the doctor, my blood pressure was through the roof, I had depression, and just low self-esteem, thought everybody was looking at me thinking how fat I am, and you know, all that sort of stuff. So when I came here, I'd made up my mind that I was going to do it. I didn't tell my husband until 2 days before the surgery. So it was a big surprise to him. But this is what I looked like before I had the surgery. So 5 months on, and I'm still going. Best I ever did in my whole life was have this, and I wish I'd had it earlier. I used to eat out all the time, have all the wrong foods, could always fit dessert in, always. No matter how full I was, I could always eat dessert. Now when I go out, I have share an entree with my husband. I thought having this surgery would stop me. I wouldn't be able to go out, socialise properly with my friends, all that sort of business, because people used to tell me, oh, you won't be able to do this and you won't be able to do that. I haven't changed a lot of socialising. I still go out to restaurants. I just share an entree. Don't have dessert anymore at all, because I'm full on what I've had for the entree. My whole eating tastes have changed since I've had the surgery. Where I used to pig out on chocolates and lollies, especially chocolates, I now do not eat chocolates. I have no desire I've even tried just a little bit of chocolate, can't stand it. Lollies, can't stand that. My thing is, this is really weird, juicy tomatoes and peas. Cannot get enough of them. I know it's weird. Go to Big Rooster and get my. Oh, sorry. So yeah, my whole eating tastes have changed. I used to love KFC, Big Rooster. What's the HJ one? Hungry Jack's. I couldn't remember what it was. And I used to live on that sort of stuff. Yeah, I don't eat any of that stuff anymore. I did try once after the surgery, and I went through the drive-thru and I said, "Can I have a Whopper without the burger?" And because I'm thinking I can't eat the whole thing, I'll just have the salad and the meat. So they did do it, but I think I had about that much, and I thought it was the grossest thing I'd ever tasted in my life. And I just don't eat that stuff. It's lots of fruits, salads. Your whole taste change. I had the surgery.
Did you do the sleeve or the band?
I had the sleeve, so I've still got a lot to go yet, but I'm quite happy with the progress. I'm doing it slowly, and I don't feel like I'm missing out on anything. I do a bit of walking. I wouldn't say I do huge amounts of exercise because I don't. With my job, it involves a lot of driving and walking around sites. So I had about 10 days off after surgery and then went back to my job. I was able to walk around and do all that sort of stuff. Didn't lift for a couple of weeks. The only thing I probably found was a little bit hard was I was tired for the first few weeks until my body got used to it. Didn't really have a problem with the liquid diets, the pureed, any of that sort of stuff, because you can blend a lot of food and get your nutrition that way. The thing that I did find hard was drinking the water, but once I always kept bottles of water everywhere and I just sip it as I would go. What else? There was one thing I wanted to know, how big's the scar? I don't know if you want to know that or not, but you have a scar here, and which is about that big, and a tiny little one on each side here. I was up and walking around as soon as I was awake after the surgery, had no pain, wasn't on any painkillers. I did not have any problems with any pain whatsoever. I was on nothing even when I went home. And my biggest thing was, when was I able to drive? I had the surgery Thursday night. I got in the car and drove back from Brisbane to the coast on Sunday and had no problem with that. I'm just trying to think what else I can tell you. But it hasn't stopped me from doing anything. Even when I was on the liquid diets and stuff, I just made sure that I was always planning ahead to make sure that if I wasn't near home or something, I had something in the car. I always have snacks in my bags, snacks at work in my drawers, everywhere. Everywhere I go, there's a snack. The amount of food that you can have. For breakfast now, I have one Weet-Bix, or a piece of toast with Vegemite. You might think that's hardly anything, but that fills me up to the brim. And lunch, I'll have a little tuna with a couple of little crispy crackers, or I'll have a piece, like half a salad sandwich with the crust cut off, because I just don't, well, I don't want crust and I don't want to feel overfull. I have done the eat too much once, and that's all you need to do once, because you will never do it again.
Because you like it, or it makes you want to?
It makes you feel very uncomfortable that you need to lay down. Really? And you learn the first time you don't do it again. So now I know exactly when I need to stop.
Can you tolerate dairy still?
Yeah.
Like if I was someone like me who I envision myself as having still a really just an egg for breakfast or something like that.
Yes, that's
not necessarily with any of the bread or anything. That's cool.
Yeah.
But I was a bit concerned that maybe some of the
The
I eat,
products that are
still eat
dairy.
cheeses.
Yeah, good.
Before I had this, I was a big milk drinker. I would drink 3 litres sometimes in a day or two. Couldn't help myself. Now I still love my milk. The only thing that's changed is I used to drink hot coffee and tea. I don't touch that coffee and tea anymore. I would drink an iced coffee. I don't know why. I just don't like hot coffee anymore or hot tea. But I eat everything that I was before. Sometimes you can eat something like a piece of meat. I used to like things well done. Now I find it too dry, that I now eat it medium, because it's still got quite a bit of juice and stuff like that in. So I always have something that's got a lot of juice or that's moist or got gravy and stuff like that. But yeah, it doesn't stop you from doing anything. Best thing I ever did, and if you're seriously thinking about doing it, do it. You won't have any regrets. And I was one of those people that checked the web. Oh my God, this lady had this with this, and you know. But since I've been here, these guys are wonderful. They've really given me a lot of support and stuff like
And
that.
if it's all right to ask, what's been your average weight loss to the 5-month mark? If you
Do you know what? When I got out of hospital, I'd quickly run over to the scales, and I'd stand on it and I'd go, oh yes. And then, you know what? I started getting obsessed with the scales, and I went, no, I'm not doing that. I've done that all my life. I'm not doing it now. So the only time I ever come in and get weighed is when I come in here. And you know what? I don't even think about my weight anymore. I don't think about what I'm eating, and I'm happy with the weight loss that I'm losing. I can tell in my pants and stuff like that. I haven't worn these for about 10 years maybe.
I've got a pair that look just like that, I think.
Yeah. So I've lost about 22 kilos, and I'm happy with that. Other people would lose more, but I've been happy with what I've lost, and I haven't been obsessed with it.
Well, you'd never lose 22 kilos in 5 months. Anything
Yeah.
else you ever tried, would you?
So, and it's not as if I've been going to the gym and going like a bat out of hell. I've just been doing a bit of walking with the dog. You know.
Can you tell us about the medications that you were offered that for
Yeah.
6 weeks, which was, I think, a really
Yeah.
amazing result for it to
I was on blood pressure medication, and I was on depression pills. I came off both of those because, you know, with the depression, you know, I'd had a car accident and I just couldn't do a lot of things. And since I've had the surgery and the weight loss, I don't have problems with my neck anymore. Because I couldn't do anything, I was just so depressed. I would just lay on the bed and do nothing. And since I've had this, I'm able to do more things, get up and do things. So, which I was able to come off my depression pills and my blood pressure. My blood pressure's actually normal again, which is fantastic, because the doctor scared me when he went, oh my God, your blood pressure, you know, you've got to do something about your weight. And my parents have weight issues, especially my mother, and she's on that much medication. I just did not want to be like Mum. I mean that in a nice way, Mum. Yeah, I hope she's not watching. But I just didn't want to be on all those tablets all the time. So, and that's why I did it. I did it for me, because us as mothers and fathers, sorry, we do everything for our kids and that, and I thought, no, I'm going to do this for me.
to launch the running clinic because it was one of her goals that she wanted to learn to run. And you know, she's done amazingly. We're so proud of her. She's actually already running 5Ks in one at a time. Her first milestone was actually being able to run, I think, about 300 metres. So you know, it's a really good opportunity to say that it's actually sponsored. You only have to pay $10. So if you live actually close enough and you want to get involved in something that's fun, that's designed for things that we like to offer and promote for you. We do on reception. She happens to be a qualified chef. We've started running some healthy eating cooking classes. Some of those are available online. Some you can actually come in and be here with them, learning some just new techniques and re-educating yourselves on something that might be a little bit different and might give you a healthier outcome down the track, because ultimately we want you to be a healthier person inside and out and keep you out of the nursing homes, away from the cardiologist's rooms, away from the endocrinologist, and hopefully lead a really healthy lifestyle for the rest of your life. I'd now like to introduce Stephen, and I have to say how exciting to have a male patient come and share his story. We've got a few who are absolutely fabulous, but the thing is that so many men don't actually see themselves as being overweight or obese, and they don't often see the need to address their issues. And we do need to reach out to more men in our community who do need our help. And that's one of the reasons why I really appreciate having Stephen share his story.
I'm embarrassed, Janine, when you were just introducing Steve. He said how nice it was to have a gentleman come and share with us tonight. And Janine said, especially a hot one.
Good evening. I'd like to say congratulations because you've made the first step. That was my hardest step. I remember ringing Carol on the phone and going, oh, I feel so weak that I have to do this, and I was embarrassed. I came to one of their seminars, and I think I paid my deposit on the way out the door. I was just that keen. I think it was 4 weeks from seminar to my operation. My operation was the gastric sleeve. I had the gastric sleeve by Dr. Adib at the Wesley Hospital on September the 17th last year. I was 130 kilos. Today I jumped on the scales at 83, so I've lost 47 kilos.
Hence the hot comment.
The first question I'd like to answer is the one that came from up the back. It's the freshest one in my mind. Since I had my operation, my girlfriend who came down for the original seminar, she's lost 12 kilos. And that's just purely through supporting me, lowering her own portion sizes and increasing her exercise. So it's also been a life change for her. She found it hard to move the weight, and it just goes to show that a lot of it is portion control. And I guess me having the operation and seeing that I was doing it, she really started to focus on it. So definitely, if there's any partners out there, you can almost get like a 2-for-1. You can just, they have the operation, you just eat what they eat, sort of thing. So Janine basically said everything that I was about to say. It's not the easy way out. There's a lot of struggles along the way. It's very good to have Warren, the psychologist, because he can sort of get you thinking the right ways to think about food, because you will sort of miss food, you'll sort of crave food, you'll go and make yourself this massive big meal, and you'll sit down to it and you'll eat this much, and you learn you're wasting food. So it is a learning process. Before I came down from Brisbane this evening, I went and did my week's worth of shopping, and I'm a little bit embarrassed to say it cost me $39. That's my week's worth of dinners and lunches. I find myself taking a lot of leftovers because I just don't want to waste food. So it's been financial benefit there. My original goal weight was to basically just get into below triple figures. 99.9, I would have been totally satisfied. I got to 99.9, looked at myself in the mirror and I said, no, not happy. I said to myself, get to 95, buy yourself a jet ski. So I got to 95, I think it was just before my last talk a couple of months ago. I just bought myself a jet ski, I got down to 93 kilos. So I'm looking around for my next, actually I bought a motorcycle about a month ago that I'm working on restoring. I've got all this energy now that I come home from work and I don't lump myself on the couch with...
Just as well you say the money.
Well, that's right. I don't lump myself on the couch, put my tracking out there and I work on my motorbike. I'm going to the gym 5 and 6 mornings a week now. I used to make an excuse. I start work at 6 a.m. it's just way too early to go to the gym at 5 a.m. So you make an excuse, I'm not going to the gym, that's just crazy. My alarm goes off at 4:20. I'm in the car and I'm at the gym for 5 a.m. I do 40 minutes and then I'm lucky enough I chose a gym right beside my work. So I'm straight to the coffee shop across the road. That's my breakfast. Aaron probably won't really agree, but once I have a coffee, I'm full until about 10 a.m. And then I go through my food ritual, which is 5 chicken crimpies with a semi-dried tomato on top, and that's just what I crave. I get to lunch and then I have fruit salad, and I find myself after lunch, I just graze for the rest of the day. Every couple of hours I'm hungry, so I just keep eating and eating and eating. Tins of tuna, fruit, and then at night I find myself eating everything I used to eat, but just in smaller portions. I go and buy that minute steak now, that really thinly sliced stuff, a couple of pieces of that, and I'm full, but I had my steak. I make little homemade pizzas now, but I put mushrooms and capsicum and onion and semi-dried tomatoes and sweet potato, and I chop it in 4s. I have 1, maybe 2 slices for dinner, and I'll have the other 2 slices for lunch the next day. So like one of those 10 packets of mini pizza bases lasts me like a month. What else can I say? I have not one regret.
Can you maybe touch on, Stephen, some of the things that motivated you from a medical point of view?
Oh, absolutely, yeah, absolutely. So I'm a builder by trade, and my employer sent me on a one of those MARTA medical days where I went and got put under all sorts of stress and pressure and had my health and fitness tested, and they called me into the room afterwards and basically said, you're 32, yeah, and you've got early onset diabetes, you've got high blood pressure, high cholesterol, high sugar, your father died at 47 and you're going down the same path. So I think I went home and ate a really big meal to try and get over what the doctor said. And then I just thought, how am I going to do this? So I went and joined a gym. I was working out 5 and 6 days a week. I think I lost 6 kilos in 12 months. I thought to myself, there's got to be an easier way. So I started doing some research, and I happened to come across a guy who had this operation. So I had the operation, and I've since been to the doctor. Cholesterol's down, blood pressure's down, no sign of early onset diabetes. My exercise levels are obviously increased. I'm now going to the gym for 5 days a week. I'm looking for activities all the time. If I don't take my jet ski out on weekends, I take out my quad bike. I work around my house. I work on friends' houses. I just don't stop. I can't remember sitting down to watch TV. Just active, and yeah, it's changed my life. I've just got my life back, and I actually started getting a bit excited about living beyond 47 now. In my head, it was always 47, that's your cut-off date, that's when your father died. But now, I'm thinking to 60, I'm thinking grandkids, I'm thinking all those things. So for me, it's been absolutely life-changing. I had, like Janine, I had zero pain. I was operating on a Tuesday, and I went back to work on the Monday, the following Monday. So I had 2 nights in hospital, Tuesday, Wednesday night in hospital. A friend picked me up from hospital. I went home, sat on the couch, sipped water for what felt like eternity, and 2 weeks later I was sort of slowly introducing myself to soft foods, Slurpees, and really mushy mashed potato and gravy become your friends because they're easy to digest. And then slowly introducing foods, and I thought it was going to be difficult. I thought I was going to swallow, I thought I was going to choke, I thought I was going to have all these problems, but there was no pain, there was no problems. Most of my scars now are totally healed. Not one regret in the world. Every time I speak to someone about it, they say, do you have any regrets? And I say, no, there's no regrets at all. Like, I wouldn't feel the way I feel now if I didn't come to this clinic. And yeah, these people over here, sitting here in this room, motivated me to really just do something about it and know that there's some support behind you. You don't have to be alone. That's the biggest thing for me. Well, I was originally concerned that I was going to be one of these people who didn't lose the weight. That was my fear. And I've recently started having the opposite fear. I'm fearing that I'm going to get too skinny, that I'm going to not look quite right for my shape. So I'll be speaking to Taryn probably tonight about ways I can up my calories so I don't keep losing some weight, because I'm sort of happy with the 83, 85 kilos, I think, for my shape. Thank you. I think it's a sort of a happy weight to be at, so I don't want to just keep going. So that's where these guys now step in as professionals, and they can say, well, up your calorie intake and maybe stop doing so much cardio at the gym, and maybe do some more weights or something. So if you're thinking about an operation, I went the sleeve because I've heard too many stories about the band being manipulated, and we're all in this situation because we sort of manipulated the diet. We didn't do the exercise and we manipulated the diet. So if we're going to manipulate those things, there's potential that I would have manipulated the band. So I went to the most drastic measure, but I've got the results, so I'm extremely happy. So there you go.
Thank you.
When were you here last? Because you came and spoke here a while back.
Yeah, it was 2 months ago, almost today, I think.
3 months.
3 months, was it? Yeah,
Wow.
approximately.
No, I remember, and you're looking even better now, so it's good to see the progress.
It's the beard gone, isn't it? Thanks, guys.
Thank you very much. We used to once upon a time tell people at seminars like this that our goal was not to turn you into swimwear models, but I kind of think from the reaction that we might have already done that with Stephen. Fantastic result, and I love that we have the opportunity to share that story with you from a male perspective, and it's really important that we do get that message out there. All right, now we still have one very special guest to introduce you to, and Melanie is someone who you will connect with here as part of your team. She also organises fantastic events throughout the year, whether it be coffee mornings or whatever it might be, to connect you in a more socially nice. But tonight she's actually going to tell you all about her own personal experience as a patient. Please make her welcome.
Someone actually recently told me that I was like Julie off the Love Boat when I organised all the social events, so I'm going to go with that. That's a picture of me at 120 kilos. So when I came to Weight Loss Solutions Australia, I didn't work here then, obviously. My auntie was coming to a seminar, so I sat in that seat. I know where you're all coming from. And she said, would I like to come with her? I think she said, told me at the time she was worried about getting lost, which was her nice mannered way of saying you could do with this too. So I came with her, and I'd heard, again, you hear all the horror stories, or you see a story on Today Tonight, or your friend's butcher's sister's brother's girlfriend down the road's neighbour died. I'm like, what? So I'd heard, a few horror stories. Oh, isn't that thing where everyone just vomits the whole time? So I had heard a few horror stories, and I knew one or two people that had surgery, but they're not always willing to share, and it's not something you want to come out and ask someone. So my husband had his own business, I had a beauty salon, and we've got 2 children, so very busy life. And I had all the excuses sort of in the world. And I was one of these people that I didn't eat all through the day. I was really busy sort of in the salon, I'd pick the kids up, but as soon as I started eating, I didn't stop until I literally shut my eyes and went to sleep. But I justified it because I thought, well, I didn't have breakfast, so that means I can have dry food when I'm going to get the kids from school. And I didn't have lunch, so when I got home and the kids had a snack, it meant I could have something to eat because I hadn't had lunch. And then when I was cooking dinner, I would almost cook enough, I'd almost taste enough food that it was a whole meal. Just what I would eat while cooking dinner is now equivalent to my dinner. So I was having a small dinner before dinner. And I was one of these people that was never satisfied. So there has to be another food group because I just could never find anything to satisfy me. I'd have dinner and I was quite full, but I'd be thinking, no, it's something else. I need something else. So I'd go to the fridge and it was like, oh, chocolate. Yeah, I need chocolate. Then I had chocolate. Half an hour later, no, chips. Chips, I need chips, and then I'd have chips. No, something creamy. I must need ice cream. Must come something cold, so then I'd have ice cream. No, salt, nuts. So it was just always, I was always standing in that cupboard going, what now, what now? And literally when I felt sick, it was like, okay, I'm full. So I never knew the feeling of full. I like to say to people, I just didn't have a handbrake. I've now got that handbrake that pulls me up. It just tells me that's enough now. I just didn't have that portion of my brain. I said I wasn't programmed like that. And I think the thing that people don't realise, I said I felt like I was a food addict, which I feel, and a lot of people do, that it is a genuine condition. I said, like a drug addict, it's like saying to a drug addict, you can have a little bit every day, not as much as you want, not as much to give you a high, but you can have a little bit every day. They just wouldn't. They'd just take them away from it. Whereas with a food addict, you can't just take them away from it. So they're always around food. So it's really, really difficult when you are a food addict to have that stop or that cut-off point. I'm a bit greedy, I've had a band and sleeve. So I started with the band. As I said, when I came to an information night, I'd sort of heard the information. I was a bit of a control freak, and I thought, okay, well, I might just decide I don't want to eat that little amount of food. I was, as I said, food addict. I was terrified when they talked about the portions of what you could eat afterwards. I went, yeah, you expect me to eat that much a couple of times a day? I don't know. I might not. You know, I don't know about this. I'd been on every diet, like most of you here probably. You know, the soup diet, and the pineapple diet, and the shake diet, and the all carbs, and the no carbs, and the all protein, and the no protein, and Jenny Craig. And so I'd done all the diets. And that's sort of another annoying thing. People would say, why don't you just go on a diet? You don't think overweight people have been on diets. We've been on all the diets, just you don't want to do it for the rest of your life. You find one that works, you lose 10 kilos, where you put back on 12. So dieting it's just not something I wanted to do forever. And I couldn't do it forever. I don't have that willpower. That was sort of what led me to that decision. But I decided on the band because I wanted to say, okay, I can have it this tight, I can have it this loose. If I decided, you know, I don't want to live with it, I could have it loosened off and pretty much eat like normal. So I was not prepared to commit to the sleeve at that time. I said, no, I don't want anything irreversible, and I might just decide I prefer to be big. So, so that was why I chose the band. My auntie had the band as well. We both ended up going to have surgery. Yeah, when I got home, sort of a little bit like Janine, my husband was like, how'd Marie go? I went, yeah, really good, I'm having a lap band. It's like, what? So it wasn't something I'd contemplated. But again, I had a very different view of who lap band or who weight loss surgery was for. I thought, oh, they're those big people that you see in Dr. Phil that have to get cut out of their house and that type of thing. I didn't realise that it was just for most overweight people who'd sort of tried dieting. It's like, it's for normal people, it's just for people like us. So he was a bit hesitant at first. He's like, you're going to what? And of course I was so excited. I've gone running to work and told everyone that had listened. And I was a beauty therapist, so I'd see sometimes 15 people a day. I'm like, guess what I'm having? And I started to get a bit of negativity. Oh, what are you doing that for? Or, oh, did you see that story on Today Tonight? Or blah, blah, blah. Why don't you try a diet? Have you tried exercise? So that sort of really got to me as well. I'm like, yes, you all know, and you've all watched me over the years, and I was just getting bigger and bigger. So I stopped telling people, I'm not going to tell anyone. I'm just going to do it myself, and after I've had it done, hopefully you'll all have the good manners to not say anything bad, because it's too late then, I've already had it done. So I did stop telling people for a while, and I think there is it's not as much now, but there is a real stigma with weight loss surgery. People call it the easy way out, or the cheats way. So there's nothing easy, and I can't see why it's a cheats way. It doesn't buy you food, it doesn't prepare your food, it doesn't make the choice for you, and it doesn't put it in your mouth. You have to do all that yourself. So I can't see why it's the cheats way. It's not going to put that chicken fillet in my mouth as opposed to the Mars bar. My hands still choose what I eat. I still tell myself when it's enough. I know when I feel full enough, when it's enough. So, and as for being the easy way out, you're putting your body through surgery. So, you know, I have to say I felt worse when I was on the all-protein diet than I did after surgery. So I was torturing my body anyway with all the different diets and packaged foods and things I was doing anyway. So for me, it's certainly not easy. It's not the cheats way, and it is not a magic wand. I think because I've been big so long, I thought, if I'm thinner, my life is going to be so much better, and my kids will behave, and everything will be wonderful, and you know, the pavement will light up when I walk, and I just thought everything would be wonderful because I've never been a thin person. I'd always been a really big person, so I didn't know how thin people lived, and I got thinner, and the pavement doesn't light up, and my kids don't behave, and so it's not a magic wand, but it's certainly going to help you get control of your food and the way you feel. And I know it is the way you look. People say that, oh, do you feel better? Because you look better. I said, well, it's not all about that. When Warren was talking about the rides, I have to disagree with that. I sort of did the opposite thing. I'd always wanted to go on the rides with my kids at parks and things, and I never did because I was terrified. I did actually get on once and had that thing rammed on me so tight I had to hold my breath for I think the 2.5 minutes that the ride was because I just couldn't breathe. So I thought I'm never getting on that thing again because I'd hate to be asked to get off. And my daughter always wanted to go horse riding for her childhood, and I told her that I was terrified of horses. I was just terrified of getting on the horse and they'd ask me to leave, or the horse could handle me or whatever. So we never did those sorts of things. So it was little things like that. People who aren't overweight don't realise. Getting on a plane too, I'd see big people walking down the aisle, and I was so big I'd be thinking, who's going to sit next to me because we're going to be on top of each other. Or whoever did sit next to me, I'd be thinking, oh, please be nice because my legs are sort of coming over onto your side of the seat there, and it's all, yeah, it was very... People who aren't big don't realise seminars, which is a bit funny now, but on as much because I hang my clothes out on the line. They should be, whereas they were so damn big. I'd always hang them out on the line, sort of push them in a bit because they just looked so big when I hung them on the line. It was so confronting to go, that's my shirt, oh crackers, I think I'll just hang it there. I didn't want to look at the size that I was. I really was, as I said, I sort of was in denial because it was too confronting to think about it any other way. So snacks to me didn't count. I used to drink from Zarafas. My drink from Zarafas was white chocolate mocha, which is made on full cream milk. And I had the biggest one they made. It was made on full cream milk. It was coffee. It was vanilla syrup, and then it had cream on top and little chocolate sprinkles on top of that. And I like sugar in my coffee, so I'd have 3 because it was a big one. And I'd have one of those nearly every single day. And the calories in that now is probably more than I'd have in a whole day, and that was just one drink that I'd have every day. So that was, now I have a soy, because someone was talking about dairy before, sorry, who needs to that? Yeah, I've gone off dairy a bit. It's not that I'm intolerant to it, I just find it doesn't sit well in my stomach and fills me up so quickly, so I've gone to soy, which I really like, or if I go to Zarafas now, I have a cappuccino, and I ask for a bit of extra water in it. I don't like the cream, I wouldn't have chocolate sprinkles on top, I certainly don't have 3 sugars. So my taste has just changed, I don't like creamy food. Same with I used to love anything in a cream sauce, whereas now it would be a tomato sauce or something. I wouldn't have anything in a cream sauce. And fried food is way off, way off. All you can taste in the fried food is the oil. So you have to slow down when you've had either of these procedures.
Why did you go from one to the other then?
Oh, sorry. I had the band for about 2 years, and we were talking about the vomiting. I had a really bad vomiting bug and vomited my heart out for days and caused the band to slip. At that point, they said they could just reposition the band, which just would have been a day's surgery for me, or I could go the sleeve. I'd realised by that stage that I was clearly surviving on that small amount of food, and I was doing really well. No, I'm gonna have the sleeve. I'm gonna commit to this for life. So I was happy to do that then. So that's when I had the sleeve. Now at this stage, I'd worked here for a little while by then, and I would tell other people what to do, and I knew what to do myself. I had the band out for 8 weeks, and I put on 9 kilos. It just showed that my brain hadn't changed. I didn't have my handbrake. I knew what I was meant to do, and I'd be eating something and look down and go, oh, it's all gone. I just didn't realise. So I like to talk about the Tim Tam thing. I said to people, now if I feel like a Tim Tam, I have a Tim Tam. I have one. Whereas before, if I had one, it meant 1 packet. There was no such thing as one. They didn't come in ones. I always used to laugh about the serving size on the back. When you turn them over, it says calories per packet, calories per serving. I'm like, the whole packet is the serving? What is that for? What's that stupid thing for? I just didn't get that. I'm like, how many is in a serve? It's like 10. That's what's in the packet. To me, that's what a serving was. It was a packet. So you can still have your treats. You can still have little things you want, but you're just satisfied with a small amount. Same with a sandwich and bread. Some people say they can't have breads. I don't have it a lot because it fills me up. As Janine said, you don't have the crust. I actually love the crust, but it fills you up a lot. So if I had a salad sandwich, it would definitely only be half. But if I just had Vegemite and cheese, I could almost have 3/4, which didn't have as much filling in it. So it's just a choice. I don't have fried food because you can really taste the oil. You have to chew your food a lot more, and like sort of a lot of people who consume a lot of food, we just eat it too quickly. So I would inhale, I would literally chew something twice and swallow it, and I was on to the next thing. Whereas if you chew something a lot, especially like hot chips, they were great and they were salty and they were hot. Whereas now if I have hot chips, you put 1 hot chip in your mouth and chew it for a long time, it just sort of tastes like soggy potato. So it's just not good. So you choose different things, and at the end of the day, I'm still a guts by nature. I will admit that. If I can have a big bowl of salad and fish, or 6 or 7 hot chips and 2 nuggets, I'm going the salad and fish because I get more. So that hasn't changed. that part of my brain sort of hasn't changed. As for, I'll just go over a little bit about the differences with the two. The sleeve is not as forgiving as the band. If you overeat with the band, I'm going to get graphic and talk about vomit. They talk about, people being sick all the time with the band. It's not necessarily vomit like when you're nauseous. It is literally what you have just overeaten in a nice little saliva ball. So that's basically
Is that what they
what
call
it is.
sliding or something? Somebody said something on the internet like
that. They couldn't get it down, so your mouth produces a lot more saliva.
Saliva.
And get something called
I used to call
sliding,
it the
they call it, or
jellyfish
something.
because it looks like a jellyfish when it comes up.
Yeah.
So it's, as I said, you don't feel sick, you're not out of action, you don't have to go home from work or anything. If you overeat, you can literally take a trip to the bathroom, you'll feel it, you just can't swallow. You don't feel nauseous, it's just like, oh, that's just not going down. Furball, that's so good. It's just not going down, you're swallowing, you can go up to the bathroom and it just comes up. And it's not all the contents of the day, it's what you've just overeaten.
You feel your eyes are going to pop out of your head.
No, it's not like when it's not like when you're unwell with vomiting. It's not like that at all. So don't worry, because I'm not a good vomiter. I'm like, oh God, I can't stand this being sick business. But no, it really is what you have just eaten is just stuck there. It just comes up.
So how long before you had the lap band? You had the lap band out, and how long was it before you had?
8 weeks. 8 weeks. And that's when I put on the 9 kilos in the 8 weeks. So.
Okay. When you lose the weight, does the skin go back, or you've got extra?
I've had a bit of a tighten up. That has to do with your age, your elasticity in your skin. I mean, I'm over 40, so of course it's not as bouncy as it used to be. It stretches and doesn't quite go back anymore. The younger you are, the more it helps. Exercise, that type of thing. Some people have better elasticity in their skin than others. So we've got people that have lost 100 kilos that hardly have any excess skin. So it's really an individual thing as well. So I mean, I knew from my pregnancy that I just didn't bounce back. So I was like, I just didn't have that good skin.
Yeah.
As for the sleeve, when you overeat with the sleeve, it's not a trip to the bathroom to get rid of what you've just had. You feel sick for hours. So it's not. I always thought they were very similar. I went, oh, they're all much of a muchness. They've got to be much of a muchness. No, they're not. So if you overeat with the sleeve, as Janine said, you feel like you need to lay down. You feel nauseous. You feel ill. You've got a pain in your stomach. You really feel quite vile. So it's not as forgiving as the band. As Janine said, you will do it once. You don't know your limit until you push it. Everyone has a different limit. So you'll probably do it once. And it's not nice. But you don't know until you get there. It's just when you hear that little message or you feel that little message that says you're full, you just stop because you know the consequences, especially if you're out or you're at work. You think, I want to feel sick all afternoon. You can have the 2 little forkfuls left on your plate, and it's that whole clean what's on your plate, eat what's on your plate, like Granny sort of taught us. I'd be looking at that going, oh, no. And my husband will go, it's just 2 mouthfuls. I'm like, yeah, but I'll be sick all night. So send it back. I was one of these people that used to eat off everyone's plates. If the kids left anything on their plate, I was like a seagull, it was mine. And I always used to take all the plates to the kitchen after we'd finished eating, because if anyone had left anything on it, that was my opportunity to eat it. So I used to say I treated myself as the bin. Leftovers never went in the bin, they all went in me. But they didn't count. So if anyone had left a sausage and that one had left a bit of broccoli and that one had mashed potato, I would eat all of that after I'd had my own dinner. I was just cleaning off the plates. Now, my poor dog's gotten so fat now, it eats all the food that I used to eat off the plates. So I would just, again, I never counted that. So that was just cleaning off the plates of what was left. Again, just not satisfied. So now, when I'm finished, that's it. It goes back. Same with at a restaurant. When they were talking about ordering, I often have the entree, but if I really, really want something that's on the main menu, I order it and just eat a third of it. Share it with someone who's with you. I think a big thing people talk about is telling people. If you don't want to tell anyone, you don't have to tell anyone. You're not lying if you say to someone, I am eating less. My portions are much smaller, until you feel comfortable telling people. You will. In the end, I started telling people, because a lady actually said to me one day, she was making another appointment, she said, will you be here next month? I said, yes. Why do you not think? She said, oh, we've just noticed you're losing so much weight. And I went, oh, do you think I'm sick or dying? She said, oh, yes. I went, no. Okay. And I was like, all right, I've got to start to tell people. So that's when I started to tell people that I'd have weight loss surgery. And they're like, oh, we can all stop gossiping about you behind your back. So, and they're also more supportive. You go to a luncheon or something with people that didn't know, and God forbid you go to a school thing, and it was sausage sandwiches. I'm like, I can't eat sausage and I can't eat bread. If people know, they just tend to be more supportive. Oh, do you want me to throw on a kebab, or do you want a piece of fish, or I was going to cook this, is that okay for you? So people are more supportive, you find, if you tell people. They tend to, if they're doing, we're going for walks or whatever, do you want to come? So they really are. You don't have to keep it a secret. Don't feel bad about what you're having. You're doing something to help yourself. So you're doing something to take control of your life, take control of your weight. So you should be proud of that. Never be ashamed of that. but you've got a good support network here. So if you choose not to tell, you've got Warren, you've got us, we've got Facebook pages, there's private Facebook page as well. So you can chat to people, like-minded people, people in a similar situation, aren't going to judge you, and that you can share with if you choose not to tell other people as well. I've tried to keep it all in a bit of a nutshell tonight, so I think everyone else covered it. But any questions? No? Good. Great. Thank you. Just referring back to your question about loose skin, we do have a plastic surgeon here on board because we know that for many people that will become an issue down the track. It might be for some people their arms, it might be for others their tummy, thighs, whatever. But I think it's really important for us to be able to look after you here and to have that option if you do need it down the track, that you can do that. And probably one thing that I will say is if you are considering to self-fund your surgery for bariatric surgery and you think that you might be someone who needs to have some form of plastic cosmetic surgery down the track, I would encourage you to take out private health insurance. I'd encourage you to take out private health insurance anyway down the track because it means that we can also always look after you no matter what, which is really, really important. We don't want you to ever have to have a readmission to hospital for any reason whatsoever. But if you do take out private health insurance, even post-bariatric surgery, it means that we have the access and the opportunity to care for you no matter what, and that's really important to us and for you as patients. So just something to think about. We can give you fee sheets and things like that tonight. I'm not sure if you're aware, but for anyone who's here tonight, and that actually also is relevant for the people who are watching us online as well, that we had made a very special offer, and this was actually something that came up at our last seminar. We had a question asked of our psychologist, well, what happens for support after the first 12 months? Because not only do you get the routine visits that Warren mentioned, the specific ones that are, we like to make them compulsory as much as we possibly can, but you also have access to unlimited support. And that means if you really feel and if you identify when you see the team that you're someone who needs to come back and see the psychologist once a week, once a fortnight, once a month, same with the dietitian, that you actually you've covered yourself for that, you've paid for it, you can actually come as often as you like. It might even be as simple as a phone call, but if it's over the phone, then it's actually booked into our system the way same as it would be a face-to-face visit. But that is really, really important. It is a value proposition for each and every one of you to embrace that and take it on board and make sure that you choose to engage with the team and make the most of your follow-up opportunities. It's really in your hands. Once you've actually made that decision, you've committed yourself to have bariatric surgery and you've made that investment, you've made the investment already in yourself. We have invested in an incredible team who have been improving and in working on their skill set to work with you as patients for many years now. So the opportunity is there for you to work with them as often as necessary for you. So I would, I can't encourage you enough to make the most of that opportunity. But getting back to the question at the last visit with the person who actually said to our psychologist, well, what happens after 12 months, where am I then, and what happens to me then if I need further support? So we actually offered an additional year at no extra cost to access that team support, and I've extended that for everybody who's here tonight. So if this is your moment in time where you wish to take the next step, then you will have access to a complete 2-year support program, which is exceptionally valuable to each and every one of you, and the same if you're online, you're welcome to access that as well. We're still here, so if you'd like to make an appointment tonight, you're more than welcome to. We bill all of our surgeon consultations. There's never any obligation. It's an opportunity for you to come and have a one-on-one assessment, talk to the surgeon, or you might want to see our dietitian and psychologist first, which in my mind is probably a better way to go, because it means that you can have that opportunity to discuss your personal circumstances, really be well informed, and you'll know what is right for you by the time you've seen Warren and Taryn. Or in the case of you might be seeing Kerry as well, because we do have another psychologist who is also wonderful to work with. She's only here on Wednesdays, so it just depends on your schedules and what works for you, but there's flexibility. So I think that basically covers everything. Any questions?